Greetings from Aster CMI Hospital, Bangalore. My name is Dr. Anoop P. I am consultant hematologist, pediatric hemato-oncologist and bone marrow transplant physician. Here is my colleague Dr. Stalin Ramprakash, pediatric hemato-oncology consultant and bone marrow transplant physician. We have our friend Aquilla from Nairobi who has done a treatment for a condition called sickle cell anemia. So over to Dr. Stalin and Aquilla for explaining what treatment he had.
Aquilla is a young man, 18-year-old, who has come to us from Kenya for his sickle cell disease. So he had went through a lot of problems the families faced there before they came to our bone marrow transplant unit. They will explain what they had been through.
Okay, hello, I'm Saline Okwara, the mother to Aquilla Vitllas. Actually, Aquilla was diagnosed with suffering from sickle cell at the age of 4 years, 8 months. He had several problems, fevers, blood shortage. He was transfused severally, and that condition kept on and off in the hospital wards, back at home. Finally, I heard about the bone marrow transplant being done in India via social media. I tried to consult my friends. Then I organized to come to Aster CMI Hospital here in India, where he has been actually transplanted, and I thank God, all is good.
My name is Aquilla Vitllas. I've been having the sickle cell disease since I was 4 years, but as for my life experience and what I've gone through, this disease has caused me a lot of pain since I was in primary school. Sometimes I could be in class and then sometimes I could be in the hospital. You could never know when you'll feel the pain, but sometimes it's also actually God helped me. I have undergone a lot of process until now. I even understand. I can also place for myself some needles because I understand the process. I've undergone this process here in India and I feel so much good because I think for now my health is okay. When I came here in India, I was feeling somehow bad, but through the process and I've gone, my body has overcome the disease, and I think for now I'm okay, though I'm still recovering. I've also undergone some, I don't know how can I explain. I went for some transfusion and admission. I've been in this ICU for at least 2 times now in Kenya. Then here, when I came, I was undergone first the process of exchange transfusion, which is also done in the PICU.
Sickle cell disease is a serious medical condition. It affects a significant number of the Africans, Indians, and many people living in the tropical weather. The problem with the sickle cell disease is it is a genetic disease, but it presents in an episodic way. So patient may be okay, like how Dr. Aquilla mentioned. They can be okay one day and another day they can be in severe pain. Some of these, what we call as a crisis, can be life-threatening. On an average, the sickle cell patients don't live as long as the normal people. There is about 20-30 years age gap between the sickle patient and the normal patient, and especially if they are living in poor resource setting, many of them don't survive to make it to the adulthood as well. Luckily, the family approached us, and his own brother was a 10/10 full match, which makes him a good candidate for transplant. So we went ahead with the bone marrow transplant. So in bone marrow transplant, what we try to do is we try to remove the patient's stem cells by giving chemotherapy type of medications, and then give the donor cells so that they will go inside and start working. So now it is working very well, and effectively his sickle cell disease is cured, and he hasn't had any problems since the transplant. Now the further process is only to come off the medication slowly. So we expect that around 6 to 8 months time, we will completely stop all the medications and he can lead a sickle cell free life, and hopefully that will completely change his life.
Okay, as for the sickle cell disease, I understand the pain that many people undergo through this disease. For me, every time, like when I feel the pain, I used to just cry every time, but now that I'm cured, I think it will be very interesting in my life. I was planning to be a pilot, but when I looked at all the qualifications that pilot undergo when I had that disease, I knew I could not qualify. But after I was cured, I find that a person can become a pilot again, because you have to have a stable medical records and you should also be healthy. So people who have this disease should come out so that they can also be given this opportunity to be treated here. In Kenya, there where we're staying, there's this insurance fund called the NHIF, which can sponsor a lot of children who have this disease. If they can come out, then the government will sponsor them and also coming to be treated like me. They should not hide, because some people think that if you have sickle cell, you automatically at the age of 18 years. Like my friends also used to tell me when I was in primary, that only after 18 years you cannot go beyond there. But I think there's also a conclusion, and you can also be treated so that you can lead a good life. So for me, I think we should all come out to be treated.
So patients with sickle cell anemia, if the disease is severe and they are needing repeated blood transfusions or hospital admissions for their painful episodes, or if they have had life-threatening complications such as chest syndrome, and if they have a matched donor, then bone marrow transplantation is the answer. It is curative.
Okay, for my case, as at now, I want to thank the Aster staff, especially the oncologist department, for God who has made me reach them, and that God may add them more life to save more lives who are yet to come. As we go back to Kenya, actually I'm going to be an ambassador in my job. Whenever I'm having my public barazas, I'll always talk about treatment of sickle cell here in India. For there in Kenya, we only knew that it's also only management, but we've come to realize and see for ourselves that it's treated, and I can see and testify through my own son that he's doing well, and I know he's going out to lead a normal life. God bless Aster. God bless Dr. Stalin, Dr. Anoop, and Ragram in absentia. We are very happy as a family. Even the brother who donated is very happy that we are going back. And that is all I have. Thank you.